Welcome to the George Washington University Emergency Medicine Virtual Tour. We're thrilled to have you here. GW Hospital is located in the heart of Foggy Bottom, directly above the metro station. Foggy Bottom is located in the northwest quadrant of Washington, D.C., and is in walking proximity to Georgetown, DuPont Circle, Logan Circle, and downtown. It's also just steps away from the Lincoln Memorial and a short walk to the Washington Monument and the White House. GW Hospital has a true diversity of patients as a result of its metro accessibility, and you will see this on shift. DC is an interesting city because it's made up of transient residents such as those who work in politics, study in one of the local universities, or work at one of the surrounding national or global agencies. There are also plenty of people who live in DC full-time and have for many years. Aside from the demographic diversity of the patient population, there is also a lot of diversity in the acuity scene. Many of our patients have chronic conditions that can make their care complex, challenging, and rewarding. GW Emergency Department receives patients from all 8 wards of DC. As an academic institution with many resources, we also receive local hospital transfers for higher level of care or trauma care. Being so close to Northern Virginia, we also receive patients from the nearby suburbs of Alexandria and Arlington, Virginia. During your second year, you will have the opportunity to complete a month of EMS and toxicology. But before we discuss all the amazing electives we have at GW, let's take a closer look at the hospital. This is one of our front-end rooms. This is the section of the emergency department where most of our low acuity patients are seen. This specific room is home to our ophthalmology and ENT supplies. We see a wide range of eye, ENT, and dental cases in the ER. This room is equipped with the things we need to care for these patients, ranging from performing a slit lamp and fluorescein exam to performing a lateral canthotomy. Here we have one of our critical care bays where resuscitation occurs. Any patient with unstable vital signs or a tenuous airway on arrival will be triaged to one of our 4 critical care rooms. This specific room is outfitted with a PPE donning area, seen here, and a doffing area just around the corner. Any COVID-19 or PUI patients go into this room as it is equipped with negative pressure and allows for residents to safely protect themselves. Critical patients are admitted to our mixed ICU. You will spend 3 months during your residency in the GW ICU, where you'll take care of the sickest patients in the hospital. Every day at the GW ICU, you will begin the day with a 30-minute lecture from the ICU fellow or attending over any topic residents would like to learn more about, and a significant portion of your time on this rotation will be spent practicing procedures and learning how to take care of sick patients. As an upper level, you will also do a month of medical ICU and pediatric ICU rotations at Fairfax Hospital in Northern Virginia. This is our trauma bay. Trauma is a joint effort between emergency medicine and surgery at GW. We are a level 1 trauma center, so you will get good experience in managing trauma patients during residency. All trauma activations are managed by a team of emergency medicine and surgery residents and attendings. As an emergency medicine provider, you may be performing the primary survey as an intern that's rotating on the trauma service, doing the FAST exam as an upper-level resident on the acute emergency medicine service, or leading the trauma resuscitation as the senior ER resident. Procedures are split equally between the surgery and emergency medicine team, and as a general rule, the ER performs procedures on even days and surgery performs them on odd days. Outside of the trauma bay, there are 2 other trauma rotations. One as an intern where you will work the inpatient trauma service at GW, and another rotation as a PGY3 where you will get experience working in the trauma ICU at Fairfax Hospital. Residents leave our program with an exceptional trauma education and procedural experience. This is the area we call the dog bone. It was specifically designed so providers could all work collaboratively. On a normal shift, the attendings, residents, and PAs will all sit around the dog bone with the charge nurse located at the middle. This table is then surrounded by the nursing station. This facilitates presenting cases to attendings, collaborating with nurses on your care team, and allows for some socialization on shift. One of the unique aspects of GW is that you are afforded graduated responsibility throughout the years. We have teams in the emergency department named A through F that are primarily staffed by a resident or an advanced practice provider and then overseen by a senior resident and an attending. You start as an intern working on the less acute services with supervision from both senior residents and attendings. As a PGY2, you start to work the A service, which primarily sees the acutely ill patients. This includes all trauma activations, acute strokes and MIs, and critically ill patients that need immediate resuscitation. Once you have worked the A service, you are ready to tackle anything and you are well prepared for this task through your critical care rotations and appropriately supervised. PGY3s work a mix of all shifts in order to get equipped to see both sick and non-sick patients simultaneously and develop independent practice skills. As PGY4s, you are mostly taking on the senior resident role. As senior resident, you are responsible for supervising residents, PAs, and the NPs on the A through F teams and work closely with the attending to facilitate flow in the department and teach. You will also have access to a resident lounge which has computers, refrigerators, and TVs for us to enjoy. If you prefer to not bring food from home, you can eat at the cafeteria, which also includes a Subway and Starbucks, in addition to all the amazing restaurants in the Foggy Bottom neighborhood that deliver to the hospital. During Grand Rounds, we spend a lot of time in our state-of-the-art class center, where we work through interesting simulation cases and practice procedures. Each year, we have friendly competitions such as the Airway Wars and the Sono Wars, where residents are grouped into families and we practice procedures for fun prizes. And one of our favorite final stops on the tour each year is our holiday room set up in the hospital basement by our engineering department. Complete with trees, cookie jars filled with treats, and a model train, it is the perfect escape during an overnight call on trauma or just to grab a quick picture with a friend after Grand Rounds. We had to include this on our tour. Thank you for your interest in the GW Emergency Medicine residency program. We hope you have a safe interview season and to see you next summer.